In terms of how the donation of bone marrow happens, the donor, once they've been cleared as medically fit, which they are assessed very carefully to make sure it's safe for them to donate. Because certainly one of the biggest kind of hallmarks of medical practice is first do no harm, and that includes to the donor. So providing they're fit to donate, they're given injections under the skin for about 4 to 5 days, twice a day, to move their stem cells out of the bone marrow and into the bloodstream. Then about 5 days later, we can measure the stem cells there at a level which is enough that we can collect, and we put needles into the patient's arms like a blood donation, that sort of size, and attach them to a machine. Takes a little bit of blood out of the donor, spins it in a centrifuge, finds the stem cells because they're of a particular size and weight, and extracts those and returns the blood that isn't a stem cell to the patient. So they don't lose blood, we're just taking the stem cells out. And once, it takes maybe 2 hours or so, and once that's out, that's it. It's all finished. The needles are taken out the arms, the patient is, well, the donor is watched in a hospital setting for 24 hours to make sure there's no bad side effects, and then they're discharged home. So the stem cells that we collect from the blood are the extra stem cells. So they will have stem cells in the bone marrow sitting there doing their normal thing, functioning as a bone marrow. And the injections we give to a donor to move the stem cells out, those are extra stem cells. They don't, it's stem cells they can lose essentially. And once they're collected from the bloodstream, the injections are stopped and everything returns to normal. So a stem cell by its nature is regenerative. They regenerate themselves, they regenerate all the blood. And that's how they work until one day, hopefully as a very old person, the person passes away.
There are plenty myths surrounding bone marrow donation. This has created hesitation over the years and prevented people from becoming donors. An example of some of these myths are: bone marrow donation means you need surgery, donating is painful, donation is bad for the donor's health. These are all untrue. To know more about bone marrow donation, go to www.sabmr.co.za.